Hey everybody, welcome back to Rocketman TV. My name is Dustin Wolf with another episode. And what we're going to do today is we're going to introduce our National Medical Director, Dr. Paul Thompson, which we're going to get into here in a second. But just a little bit about me. I'm the owner and co-founder of Launch Medical. We are coming to market with products like the Rocket and a bunch of other really cool, amazing technology that is going to be distributed worldwide that people can use in the privacy of their own home and can benefit from, okay? So I myself, along with my wife, started a company called Novus a few years back here in Studio City, California. We're now the largest producer of Shockwave treatments for the treatment of erectile dysfunction and Peyronie's disease in North America. And just through good fortune and doing good business and helping a lot of people, we were fortunate enough to be introduced to Dr. Paul Thompson here, who is actually, I'm going to let him tell you about himself here in a minute, but all around great guy. He's a urologist. He's been an MD for a lot of years, and he is very well respected in the medical community. He's been doing shockwave treatments on guys with ED for a long time and done thousands and thousands of treatments. And we're very, very excited and fortunate enough to have him on as our medical advisor and national medical director for Launch Medical, again, parent company of the Rocket, which if you haven't heard about by now, we'll talk a little bit about that device, but just here in a few short weeks, it's going to be pretty well known all around the globe. So, Dr. Thompson, go ahead and jump in here, introduce yourself, tell everybody a little bit about who you are and what you do, your practice, and where you're located.
I'd love to. Thanks a lot. I appreciate it. And thanks for this opportunity to be with Launch and be on this fantastic ride with the Rocket, which is...
Oh, we're super excited to have you.
Yeah, I'm a urologist. I grew up in St. Louis and left and went to medical school in Kansas City. 6-year medical school, got out at 24. Maybe a little young, not matured yet. Had dark hair, and left and did 3 years of surgical training, and it didn't really like where that was going. Looked at urology, ended up training at the University of Louisville and becoming board certified and a fellow of the American College of Surgeons.
Awesome.
Went on to practice there for 20 years. In the meantime, I started another company called, started out as US Lithotripsy, which is shock treatment for kidney stones.
Right, high intensity, right?
Correct. And we took several of those machines through the FDA process, got them FDA approved, and started litho companies all over the country that evolved into hospitals and doctors and cancer treatment, and then subsequently a public company that we sold recently.
So let me jump in here real quick, Paul. So I mean, it's fair to say that that you've been familiar with types of shockwave therapy for a very long time.
But it's so interesting because when we started with one of the companies we took through the FDA process, they kind of splintered off, and everybody was talking about doing plantar fasciitis and delayed or non-unions, fractures. And some of the guys went off to Europe and started looking at lower extremity ulcers, typically in diabetic. And they started using a much lower intensity, and the focus wasn't so deep, so they could go ahead and treat some of these areas.
Right.
And they started healing. And no one had a great explanation of how that was happening. Right. Now we know secondary to angiogenesis. And if I'm not mistaken, there is a company that's got an FDA-approved device for non-healing ulcers and angiogenesis, which is typically what we thought when we went into using shockwave, low-intensity shockwave for erectile dysfunction, was helping the blood flow. I mean, the whole thing is, so if we could improve the blood flow, we won. So that was really interesting, and it's so awesome to be involved this many steps down the road and years later.
So you've seen this for a very long time. Yeah, that's amazing.
Yeah, I was in a wonderful urology practice in Missouri and was terribly, terribly busy. Had a a home here in Texas because the public company was here. And I sat on the board, spent a lot of time there. So subsequently, kids went off to college, and a cute girl down here nabbed me for her husband. And,
who I met, and I can attest to that. Yes, she's beautiful. And
she's a very lucky girl to have me. Yes, she is.
Stop. I love it. Well, why don't Paul tell me about your okay? So, what's the name of your clinic? Where are you based out of?
I started the Thompson Clinic in Fort Worth. That's where I'm located. We've now expanded to Houston, Austin, and looking for probably Nashville and possibly Lubbock. Early talks in Lubbock to go.
That's incredible. Congratulations. So that's pretty amazing. And you've been you've been a urologist for over 30 years, correct?
Yeah. So don't rub it in.
I don't mean to rub it in. I
was 80. I left you count your urology, but in 1988, I left as chief resident at the University of Louisville and went into practice and subsequently practiced for however many years that is. I guess that's 31 years.
That's amazing.
I did the math real quick there, but I think that's right.
So it's safe to say you're a penis expert. That's right. Okay. What led you to become a urologist, or why the interest in that specific field? Was it just, the open wide market is helping guys, or was it just something you had an interest in? Like, what was the driving force behind that? Because you could have done anything in the medical field,
Right. I like the idea. Originally, I liked the idea of being a little more focused on certain parts of the body that I could really master it, and really, I felt like I could really be good at it.
Okay.
And I like the idea. At one time, I thought I was the gentleman's surgeon.
Okay.
But, urologists see 50% of our practice is female, and that's kind of progressed into my age management practice as well. But urology seemed like a wonderful way to have a beautiful office practice as well as a big surgical practice. And you had the best of both worlds. You weren't doing trauma all the time. You weren't the trauma surgeon doing all the car accidents, and you really got to focus on what you love.
Right. Okay. All right. So, thank you for the background there. I appreciate that. So with your thriving practice now, what would you say in terms of patients? What type of percentage of men do you see coming in that have erectile dysfunction? Because there's some other complications that can happen with with the penis and some other things, but specific to like erectile dysfunction and Peyronie's disease, would you say half your patients, a third of your patients, 20? If you had to just generalize.
I'm going to generalize and say half.
Okay.
And you understand that I have patients that range from 30 to 80. But if you jump in there and look at those numbers, you've got to believe that number, because 30-year-olds, it's 30%.
Yeah.
So you've got to easily be at 50%.
Yeah.
But I don't think, even though I'm a urologist and I sit with the guys and say, hey, you talk to me about anything.
Sure.
I've been doing it my whole life. And before that, I was an adolescent teenager, and that's all we talked about. So essentially my whole life. And even then, the problem is there are so many men that are uncomfortable with it, and they're uncomfortable sharing that information. It's difficult for them. And I really think they go home and suffer in silence. Because
they don't want to talk about it.
Even the nurse at the front desk. They don't want to tell the nurse that comes in and see him. The doctor finally comes in, and in most practices, you only have 3 to 4 minutes with the doctor anyway, and he's gone.
He's gone.
That's a little different.
Yeah, and as you know, and you see this every single day, and we see it in our clinic as well. Guys that come in with ED, these are just the ones that are brave enough to come and talk about it, because we all know that the statistical number out there, if we had to generalize, is of the 100% of guys that have some form of erectile dysfunction, only 30% of those guys actually seek treatment, right? So the numbers are staggering, and what Dr. Thompson was just saying was that the generalized number is 30% of guys over 30 have ED, 40% of guys over 40, 50% of guys over 50 have ED, and so on and so forth. So as you get older, you're pretty much guaranteed to have some type of complication, right? Even if you live a healthy lifestyle and take care of yourself, which we'll talk about in a few minutes. So we're just trying to establish a baseline of numbers of just how big this epidemic is. And there's some, health factors that can speed this process up and promote, unfortunately, symptoms of erectile dysfunction. We'll talk about that in just a minute. But so I want to jump into this next question here. So you've been doing this a long time, Dr. Thompson. So what would you say are, the top 3 leading causes of erectile dysfunction? If you had to, generalize here, and from your experience, what do you see?
Well, there is a psychological component to some
For sure.
Performance anxiety, and that in the old days was, it was a huge number, and then it kind of changed, and with some of the medications, and we go back and forth. So what that meant was we really weren't doing a good job. So I would say that the majority of it is some vascular abnormality. Now we know that smokers, diabetics have vascular problems, but the typical aging patient that isn't on hormone replacement, they have a marked decrease in testosterone, which leads to endothelial disruption and inflammation, which increases the problem. So that's how rapidly you can jump into those things. Sure. Is almost across the board, it's vascular disease.
Right, which makes sense. And
I thought it was odd. I thought it was odd, and I'll just say this real quick.
Yeah, go ahead.
I remember being at a meeting with a bunch of urologists, because our public company started out mainly urologists. And one guy goes to me, goes, "Do you know there's an increased risk of heart disease with erectile dysfunction?" I went, "Yeah, it's vascular. The vascular is vascular.
Yeah,
So,
I mean, if they're having issues downstairs, they're probably having issues in other areas of their body, right?
So if you think about how many men have some form of coronary artery disease or vascular changes, you can begin to see how easy it is to get to 50% of men in my practice that have some form of erectile dysfunction.
Right. And that, okay. So, thank you for that clarification there. And we see the same thing in our clinic. And just to kind of put a timestamp on this, unfortunately, we lost the lead singer of the Cars the other day, right? Rick, I can never pronounce his last name. It's like Orlovsky or something like that. Super talented guy. I grew up listening to the Cars, but the reason why I'm mentioning that here, this guy was a lean guy. I don't know what his lifestyle was like, if he smoked or, had any other habits like that, but this guy was pretty lean. But literally within 2 days of him dying, the autopsy report came out and said that he died from coronary artery disease, right? Just a buildup of plaque in the heart and kind of all over the body. And this guy didn't look that, I mean, he wasn't, 80 pounds overweight, and, he didn't seem like he had, any other health issues like that, but who knows? But my point is backing up what you're saying is we see the same thing in the clinic day in and day out, where these guys there are several different, reasons why men can get ED. And, like you said, the majority of them, it appears to be because it's it's vascular and it's plaque buildup, in the blood vessels. So there's certainly a psychological component to this. As you know, when guys start having erectile dysfunction or performance issues in the bedroom, it really messes with their self-confidence, which bleeds over into work and relationships, and can we've seen it ruin marriages for years and years and years, right? And other relationships too. So there are several different components to it, but by far and away, what we see the biggest issue is in the vascular components of the penis. So let's jump into this as well. So before Shockwave treatments, what other treatments were available for men with ED? I mean, we know about the little blue pill, right? And its competitors. But, back in the old days, like, I say old days, 30 years ago or even 25 years ago, before these types of vasodilators came out and kind of changed the landscape of the industry, what were the options for guys?
Well, back in the old days when I, drove the buggy to the office.
With a horse?
Okay. So it was a totally different ball game. Obviously, you understand when some of these medications came along, things changed pretty rapidly, and the big problem with them is, and I'll go quickly, was the sheer cost. I mean, and still the people weren't getting the results they wanted.
Right.
Prior to that, again, we told a ton of them it was psychological. We just told them. And we do nocturnal tumescence tests on them, and they take home a machine and put all this strap and stuff around their.
What? I had no idea.
Oh, yeah. It was, and then I'd look at it in the office like, who knows? There were some vacuum tumescence devices.
Okay.
They became, you got to think that if you're carrying around like a DOP kit with your vacuum and you're dating, this is probably not going to work real well.
It's a deal killer, yeah.
Yeah, so those guys would, and then there was injectables. There was
which are still around today.
The prostaglandin E or Trimix. And anyone that's used prostaglandin E is a little more painful, but Trimix has the risk of priapism, and when you've seen one, it's disastrous. And again, you look at the time period with which people would use a pump or an injection, it was 2 years max. And they just quit. They gave up. It disappeared.
Is that because it would no longer work, or they just were tired of doing it? Yeah.
They just quit. It's
not worth it anymore.
Not worth it. So then you got to remember, now next thing was, what do you do for those guys? The few guys that come into your office.
Yeah.
Talk to you about it. Then it was penile prosthesis time.
Like an implant.
Yeah. So we do a malleable, which is you just bend it up to use, bend it down. Those, if you put them in diabetics, they eroded through the ends over time.
Wow.
And then they're done.
Yeah.
Or if you used inflatable, they broke down. And then they were closer to working pretty well. You put a pump in the scrotum and they pump it up, and it worked fairly well. But it's mechanical, and mechanical things break.
And still very invasive.
Well, and the other risk is the orthopedic surgeons who do all these implants never really talk about infection, but infection was a big problem.
Wow.
So there were risk and complications, and very, very, very invasive. And so that was a time. It's the same thing for one of our other treatment is for Peyronie's disease, and the people have curvature.
Right.
And treatment really was horrible. And you tell just live with it until you can't live with it anymore. Then we'll treat it.
Yeah, and one thing we haven't touched on, like you just mentioned, Peyronie's disease is. I know Dr. Thompson sees a lot of this in his clinic, and we do as well. We treat a ton of guys. I would say 30% of the guys that come in here, have Peyronie's disease. 25, 30% have Peyronie's disease, which is some type of a curvature in the shaft, and it doesn't even have to be that. We get a lot of guys with scar tissue or plaque buildup. They develop these like pea-sized plaque balls, underneath the tissue, of the penis, and it really bothers them. It can be painful, especially the guys with the curvature. It can be very embarrassing. Some of them, we had a kid come in here. I say a kid. We've seen kids in here, 19, 20 years old, who have had some type of sexual accident, and it happens a lot, even with older guys too, where they end up quote unquote like breaking the shaft. And what happens is scar tissue will build up because it's trying to repair that tissue, and it'll pull the shaft to one side or another, up or down, and it can be very painful. And we had a kid come in here about 2 months ago. He was 19 or 20 years old, and he was scared to death to get an erection. Forget the sex. He just didn't want an erection because it hurts so bad, right? This is a very big problem. These guys don't like to talk about it, but they desperately need help, right? So it's an issue that is, it needs to be talked about, it needs to be addressed, and there are alternative options to surgery and injectables and these types of things to treat guys with Peyronie's and erectile dysfunction. So thank you for the clarification there. And we talked a little bit about the side effects and downsides of these other types of treatments before Shockwave therapy came on. So you've been doing Shockwave for a long time. You've done thousands and thousands of treatments just like we have. So talk to me about when you first started using Shockwave therapy for the treatment of ED and Peyronie's in your clinic. Were you skeptical? Were you like, I don't know if this is going to work? Are there studies behind this? Or tell me how that started getting integrated into your practice, and what types of results you started seeing.
Of course, we were slightly skeptical.
Mm-hmm.
How is this? Is it really going to work? Are the results good?
Mm-hmm.
And of course, every physician or clinic who has their own machine, any guy in there is staying after hours doing himself.
Oh, without a doubt.
and so you become not only an expert, but you become real expert.
Right.
because you've lived it and you
You've
know the
lived it.
results. So when we started seeing this, and we can talk for a second on complications and side effects.
Sure.
Okay,
Yes.
that's it. There's none.
None.
There's none. We've seen none.
We
We've
love that
had
part.
no problems. I mean, one or two guys with it's a little uncomfortable, but even that is rare.
Extremely,
And
yeah.
most guys are totally comfortable and do fantastic. So the complications rate is extremely low. Are there failures? Sure, there's failures.
Right.
There's not 100%.
No, of
but
course not.
I would say anywhere from 75 to 85, probably falling in that 80% success rate overall, all comers. And, I try not to exclude diabetic smokers.
Right.
That's not even fair. But at the same time, I didn't want to look at this and have a highly selected group of people, a bunch of 25-year-olds. I wanted all comers and get real numbers and look at it. And our results are fantastic. Our Peyronies are, for the first time as a urologist, I look at the guys and go, I got treatment for you. And it works.
Right.
And it's not going to leave you with a deformed penis. It's not going to leave you with nerve damage where
Scar
you can't
tissue.
feel anything.
Right.
So, there was you got to understand, we came from a period of time when there was a Nesbitt procedure. I believe that's the name. It's been a long time since I thought about it. But if you had curvature to one side, you go in on the other side and take suture and wad up that other side to try and pull it up.
Wow, I did not know that.
It's horrible. I mean, it's just like the stupidest thing. And now I think about it, oh my God, I wouldn't ever do one. I wouldn't admit to it if I did, but I promise I didn't do it.
Okay. That's
how crazy it was. We had no real options. No people, some of the universities were injecting crazy stuff and steroids, and no one got any better. And they had topical creams, and no one really ever got better. One guy said, well, I took aspirin, so we put everybody on aspirin. Because what you tell people is, there's 50% are going to stay the same or get a little better, and 50% are going to get worse. So you're going to fall in one of those two things. So that's a beauty of this whole thing is, one, it worked. I have policemen, and you do too. Well, policemen that come in, park their patrol car right down the street, run in, get a procedure, jump back in, go right on patrol.
Yeah, there's no downtime.
No,
Just go right back to work.
They say, what are my limitations? Nothing.
None. That's the beautiful part about
20 minutes it's going to take to be in the office to get it done.
That's it. It's just time. And we tell the guys here in the clinic the same thing, because their big concern is, am I going to still be able to have sex? I don't want to stop having sex, if I can perform. And that's the beautiful part about this is there's no downtime and there's no side effects. And we tell all of our guys the same thing. So, Dr. Thompson, you're spot on with that. So, so let's talk a little bit about, so what makes the Shockwave work? What is the medical terminology? I mean, I know what makes it work. What makes it work. But for our users, like what can we say? Okay, well, this is the medical term, but this is in layman's terms, this is exactly what it does. So what makes low intensity shock therapy work for guys that have erectile dysfunction and Peyronies?
Okay, so the main thing is, and the beauty of this whole thing, it's all based on angiogenesis. And it's just like the non-healing ulcers. It's I've got dings going off all over, sorry. But it's the ability to regrow blood vessels and to open blood vessels. And so you're causing some, I hate the word, but I'm going to say it, some micro trauma. And trauma always sounds horrible, and I'd like to have a better word for it when I'm talking to people, but that's really what it is. If you're shocking it, you're causing some micro trauma. That's how it worked in bones. That's how it works in non-healing ulcers. That's how it works in the penis. And so not only are you treating the two corporal bodies, you're treating the outside, the container of those corporal bodies, the structure, because that has blood flow. You're treating Peyronies, which is scar tissue, which typically doesn't have very good blood flow.
Right.
So you're going in and you're disrupting that tissue, and then as you get that flow, that's how it starts to repair itself. If you start looking at, T cells and stem cells come into there, or nanoparticles come into that area and tell the tissue how to repair itself. And that's what begins to happen. And that's why we see a progression. And I tell a lot of my patients, don't tell me tonight. I don't. Some people say I feel everything on first after my first one's great. And I'm
Yeah,
thinking,
of course.
okay. Yeah, I mean, okay, it's great. It's a bonus. But I'm thinking physiologically, it's going to be 6 weeks before I'm really going to see the results.
Yep.
And in the meantime, I may have you, and I don't want to jump ahead, but I may have you use a vacuum tumescence device to help stimulate that vascular growth.
For sure.
But it's really, the cool part is you're not only creating those blood vessels inside the penis, the two corporal bodies, but also in that tissue around it that forms those corporal bodies. And so that has to be vascularized so it can expand and contract. Otherwise, it would be almost like a plaque, and you don't want plaque. You want a semi-elastic sheaths running down containing the corporal body.
Right. So, I mean, the main thing here and the takeaway here is, like Dr. Thompson said, is the angiogenesis part by growing new tissues, right? And growing new blood vessels and promoting angiogenesis, which is exactly what low intensity shockwave does. So it's incredible, kind of recapping that part. There's no side effects and there's no downtime. I mean, we'll talk about some of the other things and the cost that people can incur when it comes to that. So I kind of want to jump into that. We covered like who it works for. What we find here in the clinic is, like you were saying, you don't want to exclude anybody, but we always, try to set proper expectations with the patients when they come in. Like you and your team do. We do an evaluation, we do consultation, and just kind of evaluate where they fall on the spectrum of being a good candidate versus a bad candidate. So lots of people are great candidates. And then over here, like you said, the 80 to 85% success rate, you have 10 to 15% of guys that it won't work for. They generally typically have higher risk health factors, right? There may be some cardiovascular issues. They might be smokers, diabetics, things like that. That not to say it can't work for them. It's just the success rate isn't as high for that group of men as it is for guys that lead healthier lifestyles, right? So the bottom line takeaway is just from a candidate standpoint, guys, is that if you lead a healthier lifestyle, the chances of shockwave therapy working for you greatly expand. Okay, so you guys know this. You should be exercising. You should be eating right. Like, we don't need to get into that side. You hear about this stuff every single day. So if you want to have an amazing sex life, I mean, we got to keep the diet clean and exercise too. So let's go into. I want to talk about the cost. Okay, so we get tons of phone calls just like you do every single day. We get tons of people coming to our website, and generally speaking, the first question these guys ask, because they do some education, they do educate themselves, they do go out there and they watch a bunch of YouTube videos, and we have YouTube videos, on our YouTube channel that explain a lot of this stuff. But certainly, cost is always a factor. And generally speaking, one of the first questions is, how much does this cost? Because they want to do it, and they've done some searching out there. I should clarify by saying that right now at this current time, insurance companies don't cover the cost of these treatments in clinics. And if they did, Paul, as you'd have a line, out your clinic from your clinic all the way down to Florida, and I'd have a line from here to Scottsdale here in LA. But unfortunately, insurance companies do not cover this type of treatment right now. So it is an out-of-pocket, cash pay, process right now. And one of the things I should say, and I can't speak for you, I'm pretty sure this is the case, is most guys, even here in LA, which is a pretty, generally speaking, wealthy area, most guys that call our clinic and want to come in and do these treatments just simply can't afford it. And the standard, kind of pricing model that all these, clinics are going off of right now, at least in the US, is, the $3,000 for 6 treatments is the general, price that people are charging, because, there are a lot of factors that go into this, right? Insurance, overhead, like we just have to charge that much to be able to keep the lights on and pay our employees, right? And to help and to help guys. But it is a very, as you know, cost prohibitive treatment when it comes to erectile dysfunction. I would say 90 out of 100 guys that call here, 95 to 98% of them just simply can't afford to drop $3,000 or $5,000 on these shockwave treatments, right? So it's really unfortunate. We see this all the time. A few years ago, this thing popped into my head, and I'm certainly was not the only one to think of this. But if somebody could invent a technology that made this type of low intensity shockwave therapy effective and safe, but affordable, and a handheld device that guys could use in the privacy of their own home. It would completely change the landscape of the obstacles that guys are facing here. And what we've seen is the three main reasons, and Paul, I know you'll back this up, is the three main reasons why guys with erectile dysfunction don't seek or can't get treatment are the following. One is accessibility, right? So let's say a guy in Topeka, Kansas, there's no clinics around within 100 miles that do this. That doesn't make it realistically accessible to that guy, right? He's certainly not going to get in his car and drive to Studio City, California every single week for a 20-minute treatment. So accessibility, the affordability factor, right? It's for most guys, like I said, it's just not realistic and affordable the reality is that most families live paycheck to paycheck. Unfortunately, we know this to be true. It's not realistic for them to drop $3,000 on 6 treatments to treat their ED, right? And the third thing is the shame or embarrassment factor, right? So again, even if a guy has the money and the treatment is accessible to this guy, again, only 30% of guys seek treatment, right? Because of the shame and embarrassment factor. And you see this all the time. So if we were able to create a device that's safe and effective and affordable, we literally remove all three of these barriers by someone anonymously or being able to purchase this device, have it shipped to their house, and treat themselves in the privacy of their own home. It would be, some type of incredible technology. And that's exactly what we've done here today. And I don't want to make this, sound like an infomercial, but the reality is that Launch Medical has developed and has been developing this device for almost the last 24 months. And here we are going to market with the Rocket, which everybody's going to, see on major media outlets here in the next 30 to 60 days, is an incredible technology that is patent pending and really does work. And it's safe. And we've done clinical trials here in our clinic, and done hundreds. And when I say hundreds, I mean hundreds and hundreds of treatments on, dozens of volunteers that have come in to get this type of treatment done. And you can go to the website and see the testimonials. But I just want to touch base on this. Dr. Thompson, in your opinion, how is a product or technology like this going to change, the landscape? And I don't mean just in the US, but on a global scale, by giving men access and making it affordable to them. In your opinion, how is this going to change the landscape of men with ED?
Well, I think it's going to be unbelievable because we're not even scratching the surface. And
right.
we're busy and we're doing a lot, but we're not scratching the surface right now. And if you remember, if you go back when they came out with some of the new medication, how many, as a urologist, we always had samples, and I cannot tell you how many people would say, "You get me some of those? Can you get me
Samples?" Right.
It was people were coming out of the woodwork. So all of a sudden, you begin to see that if you can bring something that I don't have to take, I don't have to remember to take an hour beforehand, and I can go ahead and begin to correct the problem, truly correct the problem. This is the only treatment that truly gets to the bottom and starts correcting the problem. Right. Everything else is just a Band-Aid, or it's not correcting the problem. So if we can go in, and then on top of that, these people can begin to say, I'm going to clean up and change a few things. I'm going to put out the cigarettes and
sure.
and maybe clean up my diet a little bit. Maybe I'm actually going to go for a walk. That helps. But yes, in the meantime, we're doing exactly what is important, and we're starting to touch all these lives that people we would never hear from. Never. They'll just go and suffer on their own. And you have to remember, and you may not want to hear all this, but the bottom line is in marriages that fail, it's not because the wife is sitting at home thinking, oh, she wants a sex. She wants the attention and affection of her mate, her husband.
Yes,
and
absolutely.
That guy's so embarrassed that he just shuns it. He stays away.
He avoids it. They avoid sex.
Yeah, and she takes that you don't love me, or you think I'm fat, or what? It's a whole gambit.
Yeah.
And things get bad. And you say, well, how's your marriage? Well, and you just got to go, I'm not saying that an erect penis is a marriage improver, but it is
it's
a
so important.
Most people stay in the game and become a true partner that doesn't neglect their spouse. So, and I think there's a tendency to do that. Sure. I think this is a great way to reach, I would say, hundreds of thousands of people, if not, obviously that's baloney, because it's probably millions. Hundreds of millions of people.
Yes.
And that to give them the opportunity to really go in and improve things and make themselves enjoy their life.
Yeah.
I say, one thing I say all the time is, you got to go for it all the time. You got to look to optimize things and improve them. And I look at people and I say, this isn't a dress rehearsal. No matter what you believe. If you believe there's reincarnation, you're coming back as a tree. It doesn't matter. This is not a dress rehearsal. Make the best of it.
Yeah, you got one life.
Enjoy every second. And this gives them an opportunity to do that.
Yeah. So, and we really do believe that as well. And like I said, it's bringing this technology out into directly to these men across the planet and making it affordable with a device that's safe to use in the privacy of their own home is going to change the planet. And it's about time that that guys had access to this, because up until now, shockwave therapy has been for erectile dysfunction has been reserved for the elite or the rich, right? Let's just say it like it is. So why can't everybody else have access to that? So that's what we're doing here at Launch Medical with the Rocket. So I should also say, before we get out of this, this interview, is one thing we didn't talk about is we have a lot of guys that come into the clinic that don't necessarily have erectile dysfunction or Peyronie's disease. And you get guys in your clinic all the time. They just want to optimize things and make sex better. Their erections, I ask them, I'm like, so what are you doing here? You're 45 years old, you're in shape, how's your sex life? And they're like, oh, sex life's pretty good. It's fine. I'm not 18 anymore. My erections are an 8.5 out of 10 or a 9 out of a 10. But, I heard and read, or somebody told me that shockwave therapy can just make things even better. And that is the case 100%. So we get these guys all the time. We call them the performance guys, right? They just want to optimize their performance. And I know you have patients like this as well. They just kind of want to get in front of any potential issues, or just have better erections. And shockwave therapy does do that as well. So, this type of technology isn't just for guys that have erectile dysfunction or have Peyronie's disease. This is also for, I tell every guy, I'm like, if you have a penis, you're over 18, there's no reason why you shouldn't be doing this, right? Once or twice a year, if you're a younger guy, or just to optimize things or get in front of any potential problems. Again, because there's no downtime, there's no side effects. There's really no reason other than the cost factor of going into clinics and getting this done. There's still a lot of guys out there, even with the Rocket on the market, that will want to go into clinics and have a professional treat them, which is totally fine. But what the Rocket does is it makes it affordable for guys all over the planet to be able to treat themselves in the privacy of their own home. So I think that's about it, Dr. Thompson. We're going to wrap this up. Is there anything else that you wanted to add to this?
No, I think you're absolutely right. I always tell the guys, I said, erections are kind of like on a dimmer switch, and they kind of get turned down real slowly. You never really notice it until it's significant. You kind of go, and then you get a treatment with the shockwave, and you go, oh, yeah, I forgot the quality. Right. So you're exactly right. Exactly right. It's performance, and it's really for everybody. You don't have to be the 30%, 30-year-old. You can be in the 70%. You just want a marked improvement.
Yeah, I just want an improvement. So I want to thank you for your time today, Dr. Thompson. We're gonna have a lot more content coming out up to our YouTube channel, on our Rocket YouTube channel. But one thing I want to mention before we get off the interview here is, if you guys are interested in learning more about shockwave therapy, you can also go to Dr. Thompson's website. And if you're in the the local area, you're in Texas, you're based out of Fort Worth, right?
Correct.
Yeah. So if you want to learn more about shockwave therapy, or even come in and do a consultation, I encourage you to look him up and set up an appointment. But if you are out of the area and this is something that you're completely interested in, you can go to our website. Again, Dr. Thompson's our national medical director. Go to getmyrocket.com, where there's a ton of information on there. There's all kinds of video content that talks about the cost. Right now, we're taking pre-orders to bring the rocket to the market. We are in the manufacturing stage right now, and we anticipate having the rocket on the open market here within the next few months. But if you'd like to pre-order the rocket at a heavy discount, go to getmyrocket.com. There's a lot of information on there. If you have any questions, you can email us at support@getmyrocket.com. Again, Dr. Paul Thompson, we thank you for your time. We're super excited to have you on board as our National Medical Director for Launch Medical. And again, my name is Dustin Wolf, co-founder of the company. And look out for a lot more content from us in the near future. Thank you. Take care, Doc.
All right, buddy. Thank you.
All right, thank you. Bye. Hey, Rocket Man. You're out there doing your research on low-intensity shockwave therapy, and you should be. That's fantastic. I want you to know that this type of technology has been widely used in Europe for over the last 20 years, and there are hundreds of clinical studies proving that it's safe and it's effective. But the problem is, only 1% of men can actually afford to do this type of treatment. 99% of the guys get left out, up until now. Launch Medical has developed a product called the Rocket that does the exact same thing that these expensive medical devices do, but in the privacy of your own home, and it's affordable. Who doesn't want that? So go to getmyrocket.com and pick yours up today, okay? That's getmyrocket.com.